Hi, I'm Paula Lopez. I am a consultant psychiatrist. I work with children and adolescents, and I have worked in different settings in the community, in A&E and hospitals, and at the moment I work in an inpatient unit with adolescents, so 13 to 18.
Hi everyone, what's going on? I'm Antonio Ferreira and I'm a mental health activist.
Okay, I think we have some questions here from young people about schizophrenia.
Yeah. So the first question we have here, Paula, is how does schizophrenia develop?
We're still learning a lot about it. So there's a side of it that is the more biological side of it, like how your brain is responding, how your brain develops, how the receptors are, and the biological and genetic side of it. And then the other side has to do with your experiences, your background, also like reaching adolescence and the stressors that you have, social stressors, school stressors. So a combination of these two sides, maybe a biological vulnerability with a high level of stressors may lead to that development.
So it doesn't always have to develop during adolescence, it can actually develop during adulthood as well.
Yeah, definitely. It's different to have only one episode, because there are some people that only have one episode of psychosis. They receive the treatment, they receive the help, and they don't have any further episodes. And it's different to schizophrenia, which is either repeated episodes or one episode that is very long, like more than 6 months or a year.
Second question, how does schizophrenia make you feel?
This one is for you first, Antonio.
Yes. Between the ages of 16 and 18, I'd say, is when I was diagnosed with schizophrenia. And there's stages to it, there's different levels to it, because, at first, for someone from a African background, mental health isn't something that we speak about. So, I never even knew what mental health looked like, or let alone what schizophrenia meant. So I had that period of confusion, frustration, I guess, as well, because at the time you're seen as someone different from everyone else. A lot is going on in your life. I had to attend so many meetings with my psychiatrist and so forth. So you have that first stage, of confusion, frustration. You don't know what's going on. You don't know how to deal with it, sort of thing. But then, well, in my case, I came to understand it once I got the diagnosis, and doing things like this, like looking up on Google the questions about schizophrenia, speaking to doctors like yourself about it, my parents, my siblings. You come to understand it more. So at this stage now, you're probably okay. I know what's going on. I know what avenue to follow. It's not like I type in my symptoms and 20 different diagnoses come up. I actually know what I'm looking at now. I had the auditory hallucinations. For me, they were quite commanding, and I'd say they were quite distressing as well, because especially at that stage at the beginning where it's really confusing, you don't know what's going on. Inevitably you just become like quite lost with these symptoms. I guess the main thing is that it is manageable. You can manage with it regardless, as long as you utilize the services and support around you.
I agree with that. I just hearing what young people and children have explained to me, I guess that the feeling of being scared and feeling unsafe and not knowing what is happening, that sense of confusion is something that comes up quite frequently. And I think that's where we really want to help, and that's where we come with all of these kind of different tools. We have therapy, we have medications, we have sessions with family. All of that is to help with that feeling of being really unsafe.
So the third question we have here is, how does schizophrenia affect your daily life? Relationships with friends, family will be tough, because sometimes you don't know how to articulate things, you don't know how to explain something. Especially as I said at the beginning stage, you don't understand as much. People are asking you what's going on, but you can't even give that question right to yourself. So I wouldn't say it's a drastic change. It's more just that self-awareness, so you recognize your triggers, you recognize your boundaries. Like, I know for me, I learned a lot about myself, so I really gained self-awareness. So I know, okay, sometimes I can have these outbursts, and I know why I have these outbursts. So what can I do to is looking at that CBT model thoughts, feelings, and so forth. Medication might be a thing, you know, but that doesn't usually get in the way of a lot of things.
That's the goal, isn't it? To get that you can live your daily life and you don't feel like this is, you know, causing a problem or preventing you from going out and enjoying yourself and meeting with friends and, you know, doing your learning and so forth. I guess that in my mind it also depends a little bit, as we were saying before, on whether if it's an acute moment when you're acutely unwell and maybe you need a bit more help, and maybe you haven't started treatment, or you're in the process of the treatment kind of starting to help. The goal is for you to eventually just live a kind of usual day-to-day.
And I think one thing is always, if there was anything, you know, directly affecting my daily life, there are people around me in the service that I could speak to. So yeah, that's just one thing I wanted to remind people, is that, you know, you can speak about it and let people know if something is affecting your daily life, and it should be ways around it. So the next question is, how does schizophrenia medication work?
The medication that we use for schizophrenia, it's called antipsychotic medications, or the other name that we give it is neuroleptics, which kind of means like helping to slow down a little bit as well. So it helps to kind of maybe regulate the different areas of the brain that helps us to take in a stimuli and understand and process a stimuli. So the whole way that we understand the world is through our senses. What we see, what we hear, and how we kind of interpret those as well. So medication for the schizophrenia helps to regulate how we kind of take in all of that information. There will be kind of more specific descriptions about how it has an impact on dopamine and in certain areas of the brain, but in general the idea is that it helps to kind of regulate these parts of the brain that may be kind of giving you misinterpretations of the environment.
So I'm a student studying psychology and cognitive neuroscience, so I understand, I wouldn't say a lot, a fair amount of the neurotransmitters and how the medication works in the brain with your dopamine, your serotonin, your GABA, I think it is.
GABA receptors.
So isn't it, the antipsychotics, it depends on which one, of course, but they work towards your dopamine levels. That was going to be scary if I got it wrong.
You got it right.
To your dopamine levels.
Yes.
Sometimes some people have a lack of dopamine or too much dopamine, so it looks at regulating that imbalance in the neurotransmitter. Yes.
Exactly. Yes.
I hope one of my lecturers watches this.
They would be so proud. And as you were mentioning, there's like different kinds of medication. So for example, we have like the kind of older antipsychotics, and so we have some that are kind of more modern and more new. And the more that we develop our understanding of these different receptors, the more that the medications may be a bit more tailored to that specific type of receptor or a distribution of different types of neurotransmitters. So there are actually like new medications kind of coming up and finding different kind of targets of it. So we're actually learning a lot about what kinds of medications are more helpful and how to use them best. It's important as well to highlight that there can be side effects of the medication, and managing the side effects, talking about the side effects, and working through them can be difficult. That's why having an open conversation and open communication with your team is quite helpful, because if you're starting to experience a side effect, then you can very quickly say, actually this is uncomfortable for me, and you can have a choice. You can also, as you were saying before, Antonio, there's a lot of reading and kind of finding out things yourself too. You can have conversations with your team, so you can go for the right resources, read about it, and then find different options for you. So you have an active say in your treatment, and you can choose what works best for you.
And of course, medication is like meant to be just one part of your bundle of recovery, isn't it? So I think a lot of people also think that, you know, medication is meant to be the thing that does all the work itself, but a lot of it has to come from yourself, your own, want to get better, and the other resources are like therapy and so forth.
I strongly agree with that.
Yeah, that's all the questions. Thank you so much for answering all of them. I really appreciate having you here to speak about them. I'm a culprit of also looking up things on Google, but sometimes Google can take us in the wrong direction and, you know, enhance those feelings that we do, the anxiety. So it's really nice to be in an environment where I can speak to yourself, who's someone, a doctor in the field, and just have these clear answers. And, you know, if it was me, I probably would have had 20 questions, but time is of the essence, so 4 is all we could do.
Well, thank you, Antonio, for sharing as well from your own kind of lived experience. This is how it makes me feel. This is how it affects my life. I think it has a lot of value for a lot of people that are watching this to kind of see that someone can kind of go through something really challenging, but also picking up their lives.
I hope so. Yeah, I really hope so. I don't feel anyone should feel lonely in their diagnosis. Thank you everyone for watching. Follow Best For You for more information, and I'll see you soon.
Thanks.